Good evening, friends. I am Dr. Anil Daxini. I am a consultant physician and cardiologist at Astu Fortis Hospital and Daxini Heart Center. I am going to talk today on heart failure and edema. In today's session, we'll discuss why heart failure causes edema and the treatment options. The heart is the hardest working muscle that pumps about 2000 gallons of blood daily, and your body will quickly let you know that something goes wrong with it. Heart failure can be frightening, though it sounds like the heart is not working at all and there's nothing that can be done. But heart failure means that the heart is not pumping as well as it should be. Heart failure can occur due to various issues such as high heart attack, high blood pressure, diabetes, kidney disease. There are different types of heart failure. Each one reduces the heart's ability to pump effectively. So the first one is left-sided heart failure. So let me just show you this diagram. This is the heart. So the blood from the whole body, you see this blue color, it comes in the right side of the heart, and then from here the blood goes to the lungs where it gets the oxygen, and then the pure blood comes on the left side of the heart, and then it is pumped effectively to the whole body. Now I just show this heart. Again, model, but to explain to you what is right-sided and left-sided, you see we have 4 chambers. So this is the left-sided chamber. This is the left ventricle. You see this is very thick muscular organ because it is supposed to pump blood to the whole body. So it has to be muscular and strong. And this is the left atrium, and these are the valves. So this is the right atrium and the right ventricle. Okay. Now this is not that thing because it has to pump blood only up to the lungs. So you see this blue colored vein. So all the blood from the upper part of the body comes via what we call superior vena cava into the right atrium, goes into the right ventricle, and from here you see this blue color, it goes into the lung. So you have blood coming from the right side, then from here it goes into the lung. In the lungs you have gases exchange, carbon dioxide is washed out, oxygen is taken in, and then the pure blood or that blood comes to the left side of the heart. So it will come to the left atrium, the left ventricle, and from there you see this right big artery which is known as aorta. From here it goes into the whole body. So you see blood comes on the right side, blue, goes in the lungs, takes oxygen, comes in the left side, and then from here through this red aorta it goes into the whole part of the body. Now suppose if this right sided of the heart is not pumping effectively, so what will happen? The blood will not be able to push the blood effectively into the lungs. So less oxygen will go, less blood will go to the lungs. So you'll have less oxygen to the lungs. So the patient will feel shortness of breath. Also, because the right ventricle is not pumping effectively, blood stagnates in the right ventricle, the right atrium, and then the backflow in the veins. So you'll have all the blood which is coming from the upper part of the body, which will remain stagnant. Patient will have prominent veins, patient will have shortness of breath, and similarly the blood coming from the lower part of the body will not be able to pump effectively, resulting in swelling of the legs and swelling of the feet, legs, and also the abdomen. Now, when the left side of the heart fails, so your blood is not pumping effectively, so the left ventricle remains filled with blood or not effectively, so the back pressure changes happen in the left atrium, and then it will also be reflected in the lungs because the oxygenated blood from the lungs is not being able to push forward. So the fluid remains in the lungs. Once you have fluid in the lungs, normally there should be air in the lungs. But here, because the fluid is remaining excessively, it impairs the gas exchange. So resulting in what we call pulmonary edema. So if the left ventricle fails, your lungs are flooded with water. It is affecting your oxygenation. Patient will feel shortness of breath. If your right side of the heart is not pumping effectively, then the whole body's venous return will be impaired, and there will be swelling of the face, hands, legs, and abdomen. Okay. So what are the warning signs of heart failure? You will have edema or swelling in the feet, ankles, or stomach. You will have shortness of breath or wheezing, which may happen either on exercise or when you lie down. So when you lie down, what happens is that the abdominal pressure also puts further pressure on the lungs. So when you lie down, the abdomen puts more pressure on the lungs, and then you may feel more short of breath. Then you will have loss of appetite, you will have weakness, tiredness, fatigue. Now, Edema is the clinical or medical term that is caused by fluid retention. So the various types of edema, you have pedal edema where the fluid buildup is in the feet and legs. You have peripheral edema where the swelling is in the hands and legs, or you have what we call pitting edema where if you press the swollen leg, there will be a dimple and it will remain there because what is happening is that you are just pushing the fluid and then that depression remains. Or you will have pulmonary edema where the fluid will be accumulating in the lungs resulting in shortness of breath. Now, what symptoms will the patient will have, or how will the person know, or what symptomatology may have? He will start suddenly looking very large or puffy. He will say that his shoes do not fit, which they normally were able to fit, or his chappals or his sandals. He will have pain in the feet or legs. Walking will become difficult, and he may have unexplained weight gain. So now let's look at the current treatment options for edema and heart failure. Now, heart failure is a life-threatening medical condition and it has to be treated by a doctor, under a skilled doctor. You may need to be hospitalized also. However, there is something that you can always do in your lifestyle. So what are the lifestyle changes that you can do which will help you in mitigating the symptomatology and the pathophysiology of heart failure? One, reducing the amount of salt in your diet. So one should limit the amount to 1500 to 2000 milligrams per day. So it's like 1 to 2 grams per day. Now sodium is present in high amounts such as pre-packaged foods, fried foods, processed foods, ready meals, potato chips. Then regular physical activity. Okay, regular physical activity will help the heart function more effectively. Regular physical activity will decrease your blood pressure also, it will decrease your cholesterol, it will decrease your sugar, and it's like if you exercise regularly, your heart is ultimately a pump. You are optimizing the efficiency of the heart. Then when you have swelling of the legs, you can just keep your legs elevated. So with gravity again, that fluid will be taken into your body and then the body will circulate it. Now, apart from this, whenever you have heart failure, don't get afraid. Please seek medical help. And remember, there are a lot of medicines, science and scientists, and so many people have given you a lot of medicines which can make your life more efficient or more functional and fruitful. Thank you very much for your patience.